Thank you, Rahul. Next, we'll move on to Dr. Ahikam from Medicine 5, presenting metallic showers.
Good morning, everyone. This is supposed to be a spotter, but I think the title of the presentation was a dead giveaway. Sorry. Uh, so this is a 44-year-old gentleman who came with the tingling of his peripheries with hyperpigmentation for 1 year, and this was the finding on clinical examination. So, anybody? For those who didn't see the title of the presentation, you know. 44-year gentleman came with these hyperpigmentation findings on examination, loss of weight, loss of appetite over the last 1 year.
Ask him to describe the findings and then the.
So the findings were a patient was noted to have hyperpigmentation, generalized hyperpigmentation, also involving the palms and soles, with the typical raindrop hyperpigmentation noted in the palms and the soles. There was also scaling noted in the palmar aspect.
See the raindrop hyperpigmentation. Nails. What about the nails?
The nails, we're looking for means lines. There was a space of leuco here that was partly present, but it wasn't very classical, so I didn't. So here in the palmar aspect, you could see that there are small hypopigmented areas interspersed with the background of hyperpigmented patient. So I'll go ahead. This was a gentleman who came to us from West Bengal with complaints of loss of weight, loss of appetite, and predominantly sensory neuropathy for the past 1 year. He had difficult feeling of walking on a carpet, tingling sensation, pins and needles, with absent bilateral ankle jerk reflex and loss of joint position sense. And on evaluation, this gentleman was diagnosed to have arsenic toxicity. So since a spotter, I just quickly go through arsenic toxicity. So what is the source that are commonly encountered in our population? Usually there's soil, air, food, and drinking water due to contamination from arsenic containing industrial effluents, agricultural pesticides, natural mineral deposition. And other occupational hazards are those who are involved in working with computer chips, mining, semiconductors, and in metallurgical industries. Arsenic can also be seen in chemotherapy, especially when patients are treatment for APML with arsenic trioxide itself, or in homeopathic remedies also there can be arsenic. So arsenic can be exposed. Patient can be exposed to arsenic through arsenic contaminated tube wells or through the arsenic contaminated rice when the fields are irrigated with arsenic contaminated water. So what are the clinical manifestation? We could have either an acute or a chronic poisoning of arsenic. The acute the acute poisoning, clinical manifestations can include hair loss, Mees lines, which are transverse bands of opacity in the nails. We can have conjunctivitis and lacrimation in the eye, and mainly cholera-like rice water diarrhea can be present. So that is another differential for anyone with the rice water diarrhea who may have an occupation history that can be related with the arsenic toxicity. And also the patient can have a fever as well. Hyperpyrexia and convulsions and coma can also be present. In chronic arsenic toxicity, we have patients who they can have melanosis, hyperkeratosis, hyperpigmentation with a raindrop pattern like our patient, and they're also at increased risk for skin cancer, such as squamous cell carcinoma, basal carcinoma. And ocular, they can have a dimness of the vision. And GI, the patient can have weight loss, as in our patient. Vomiting, diarrhea, anorexia, nausea can also be present. And neuropathy, neurological deficits, they can be encephalopathy, a Glauben stalking type of polyneuropathy, tremors, ataxia, limb tenderness, and difficulty in walking. There can also be hematological involvement in the chronic, which is not present in the acute, such as anemia, leukopenia, thrombocytopenia, and pancytopenia. So, how to make the diagnosis of arsenic toxicity? The sample can be the most reliable one is the 24-hour urinary concentration, where the cutoff is either 50 microgram per liter of arsenic or 100 microgram per gram of arsenic by creatinine, or a total 100 microgram of total arsenic levels. Blood can also be used. The other samples that can be used are the hair follicles and the nail that can be used to identify the presence of arsenic. However, this is the most reliable mode of making a diagnosis of arsenic toxicity. One thing to be kept in mind is somebody with a recent seafood ingestion can have a transient elevation in the total arsenic excretion level, even up to 1,700 microgram per liter. So it's important when we do the 24-hour arsenic urinary concentration that the patient be advised not to take any seafood. Coming to the treatment of arsenic toxicity, the target endpoint is to get a 24-hour urinary arsenic concentration of less than 50 microgram per liter. So those who are symptomatic, in order to have arsenic elevated urinary arsenic concentration, can be treated. And the oral option that we have is to use Saxima 10 mg per kg per dose, QHH for 5 days, followed by 10 mg per kg per dose, Q12H for 2 weeks, and then we can repeat the arsenic urine 24-hour urine arsenic concentration. The other British anti-Leucide and DMPS are parenteral forms of administration. This is my reference.
Any questions?
I can't. Is there a role for samples like hair and nails and all?
Yes, sir. So the hair follicles can be used for testing the proximal portion of the hair. The method to collect is 200 mg of hair, 200 hair follicles to be collected. 200 to be collected, and the nail and the fingernails and the toenails can also be used. The toenails, since the duration for the toenails to grow is longer than the fingernails, so we can use up to 6 months to identify arsenic toxicity in the toenails. And
so when would you order those tests rather than the urinary concentration experiment?
That I'm not sure.
Like to do it when you suspect a chronic arsenic poisoning is when you will go for a hair and nails, I guess, rather than acute. Acute is more of urinary concentration rather than blood even. Why don't you do blood?
So acute urine and the chronic bladder samples.
Why don't you do blood arsenic levels in an acute or a chronic poisoning?
The reason mentioned is that blood arsenic levels are very, very low, but I don't know the reason.
Diagnosis of arsenic poisoning is very clear for acute arsenicosis and chronic arsenicosis. The diagnosis of drugs is 24-hour urinary arsenic for acute and chronic. Blood arsenic level can be used for finding of the exposure to CSF or chronic. So only in acute distal arsenic exposure. It may be a chronic arsenic exposure the patient is counted, but till yesterday the patient might have taken arsenic contaminated water. Then the blood arsenic will be elevated, or the patient might have been poisoned with arsenic today morning and has come with acute arsenic today. That also the blood arsenic will be elevated. But in both cases, the diagnostic method of choice should be urinary arsenic levels. Now there are a lot of caveats in testing hair follicles and nail for arsenic. You cannot differentiate between an environmental exposure versus actual ingestion and systemic exposure. So if you are living in an area with arsenic contaminated groundwater and you're taking that water every day, but you're drinking RO water, you don't get any features of chronic arsenicosis. But if you test your hair, it will be uh, uh, positive for arsenic levels. If the patient uh, on post-mortem unexplained death of the patient, they find elevated arsenic levels in the nail. It could mean that the patient might have poisoned somebody or the patient was poisoned. So those should not be used for clinical diagnosis of arsenicosis. Although sometimes ancillary evidence can come from nail and hair examination. Some comments about your source of arsenic. How do you think this patient was?
He's from Jamshedpur. One is
belong to the arsenic belt of India.
the West Bengal and Bangladesh area. I don't think Jamshedpur comes in the arsenic belt. He's had 3 years history of homeopathic medication intake. So we would like to test that for arsenic. We asked him this.
What the arsenic does in homeopathic medication? Because source control is the most important step. Management of chronic arsenic. Third thing, in family members.
No, family members did not have.
All the more reason why it's
The bottom.
Now with respect to management. Management first and foremost is elimination of resistance. What is the role of giving? What do you do?
This patient actually wanted to admit and give the parental therapy, but he was not willing, so he went away. We
are talking about only about chronic arsenic. What is the role? What is the benefit?
If they're symptomatic, we can treat.
Conditions with this one. There are some conditions.
No, he's having neuropathy.
So, very clear when you're giving intervention, what is the role, right? Like in give meningitis, you give dexamethasone because it is mortality. In acute meningitis, you give corticosteroids because it may prevent some neurological sequelae. So, what is the role? Does it prevent mortality? Does it prevent progression of cancer? So, the role of systemic chelation in chronic arsenicosis is unclear, whether it confers any benefit. The only thing we know for sure is that it increases the rate of removal of total body arsenic. Okay, so when we want checking the total body arsenic week after week after week, the patient who is not on chelation is a patient on chelation. If on chelation, it will drop like this, not on chelation, drop. But as long as the renal function is normal, the arsenic will come out of the body as long as it prevents further exposure. Okay, so it is unnecessary to if you're giving oral chelation, then that's fine. It's unnecessary to subject the patient for painful injections just for saving chronic arsenicosis. It does not have any evidence that it will prevent formation of new malignancies. So apart from that, especially if there's significant loss of weight, loss of appetite, you should treat the patient systemic malignancies. You cannot just attribute chronic arsenicosis and nausea and vomiting. You said the patient had loss of weight and loss of appetite.
Yeah.
Now, all the series of arsenic does not have any comprehensive evaluation of patients with arsenicosis. A lot of patients have also vomiting, that is right, and loss of weight. But nobody has really done a systemic malignancy screen on these patients. All these are isolated, poorly conducted retrospective case studies. So we don't know if they had some hidden malignancy somewhere, and that is why there is arsenic. So
we screened this gentleman. We did the cross section. 260 microgram per liter.
Any other questions we have from the audience? Thank you, Ahikam. Thank you for the presentation, presenters. It was close today. Dr. Tony and Dr. Prem Rahul did a very good job with their presentations, clinically and also approach-wise. But today's presenter would be Dr. Prem. Thank you so much.